happens after patients who are experiencing homelessness are discharged from hospital?
So that's a really interesting question, and actually, I've done a lot of research in this area because, as a general internist, I work in the hospital taking care of patients who are hospitalized, and then at my hospital, about 15% of those patients are homeless. So what we see is well, actually, before they're discharged, what we see is their care in hospital is sometimes is challenging because the person may have needs that or expectation needs that the hospital staff are not accustomed to addressing, and that may relate to a whole host of issues. Sometimes those patients leave against medical advice, and certainly they do so at a higher rate than average. And even and when they're discharged, what we often see is a discharge or post-discharge care plan that, although well-intentioned, often falls apart because of very practical challenges such as keeping track of appointments, transportation, access to medical supplies, the impact of living in a shelter on the ability to take care of follow-up medical needs, addiction, substance use issues that can interfere with the person's ability to get the care they need. So there's a lot of areas in which the post-discharge care is suboptimal, and certainly we also know from our research that the rate of readmission among people who are homeless is much higher than average. I think that the other thing to realize is that the people working in the hospital are pretty much occupied 110% with the people that they have to look after in the hospital. So once the person leaves, the patients pretty much exit their realm of awareness, and they don't really, essentially there's no active follow-up in most cases. So what we're doing now is we're doing a study called the Navigator study, where we've created this role of case managers or short-term navigators who work with people while they're in the hospital. So they meet with people who are unhoused right after their admission and get to know them, build that relationship, and then once they help work with the medical team to develop a discharge plan, and very importantly, after the patient is discharged, they meet with them and follow up with them for a period of approximately 90 days to try to ensure that they get connected to the care and the services that they need. So it's a very simple model, actually, if you think about it, but it makes a lot of sense. And what we've done is we've created this role and have 2 navigators now at our hospital. In order to test the effectiveness of the intervention, we're just about to start a randomized controlled trial where we will seek to enroll every patient who is homeless, who's admitted to medicine at the hospital, and then randomize them to either receive the Navigator services or usual care, and then follow them to determine if the Navigator service is having an impact on their ability to connect with a primary care provider, on their adherence with medications, on their satisfaction with the care experience, and on things like return to the emergency department and readmission to hospital.